Hi, Dr. Alicia Squires at Family First Chiropractic and Wellness Center, and I'm here today to talk to you about some of the most common things that typically cause low back pain. So the three things that usually cause low back pain: muscles, joints, and discs. Talking about muscles first. So the muscles in the low back can become injured for a lot of different reasons, whether you try to pick something up that's a little heavier than you thought, and then a couple days later, your back starts to hurt. So a couple of fibers in the muscle can become injured, can tear, and the muscle will start to repair itself. It starts the healing process. Well, for a muscle to be able to heal itself, it has to lock down. It goes into a spasm. It will guard itself so it cannot be utilized to its full potential while it works on repairing that injury. And this can take anywhere from a couple of days to maybe a few weeks. It just kind of depends on how bad it is. Muscle pain is usually very tight, achy, nagging, very broad type of pain. Muscle pain in the low back will usually show up in the morning. So after we sleep, we don't use our muscles very much, and so they're swollen, and we have to get up and move around. We get a lot of that swelling out of there. We increase circulation to those muscles, and you feel a little bit better throughout the day the more you use them. So when you have a muscle injury, the worst thing you can do is to stop using the muscle at all. We actually want to continue to use the muscle as best we can to our tolerance level to help it actually repair itself so it can heal faster in a short amount of time. The second thing that causes low back pain are the joints. Now, we have lots of joints in our spine. Any one of the joints that can become injured and cause pain for one reason or another. Now, unless there's some kind of direct trauma into the joint, whether you were in a car accident, fell down the stairs, got into a bar fight, whatever the case may be, the joint pain is not usually sudden. It does not happen overnight. This is something that accumulates over a long period of time, and then something small like a cough or a sneeze flares it up. So with joint pain, it can become very inflamed, very angry, gets very swollen inside the joint, which makes it very uncomfortable to use. And unlike muscles that tend to feel better throughout the day, joints actually feel better at the beginning of the day, but the more you use them, the later throughout the day you get, the worse joint pain actually gets. So depending on the time of day that you have back pain could indicate what's possibly going on. Now, the third most common thing that shows up with back pain are discs. So in between all of the bones in your spine are little cushions, little discs that allows those bones to be able to move properly. The way that the discs are designed is they can tolerate a lot of force from a lot of different angles. But what happens is with, again, trauma is a big one. You're noticing a trend here. Lifestyle changes over a long period of time can add up as well. So things like smoking, drinking, poor diet, not getting a lot of good exercise outside of regular everyday activity, sleep, hydration, all of these things, it adds into this. And so the outside of the disc actually starts to break down. So the inside of the disc can protrude through and actually butts up against the nerves in the low back. So this pressure up against the nerve, that's what causes low back pain. And this type of low back pain can actually travel, and it usually does. So whether it's up the spine or down into the legs, it's usually a sharp, shooting, radiating type of pain. And this, again, is something that is flared up by something really small, like a cough or a sneeze. You try to roll over in bed, maybe you get a pop, and then sudden intense pain. That's usually a disc. So if you have any of these, might help to pinpoint some of where the pain might be coming from, and then follow some recommendations on how to get that corrected. And if what you do at home doesn't work, then it's time to get checked by a chiropractor. If you have any questions about anything specifically, please don't hesitate to reach out and let me know. Thank you so much for watching.